Good afternoon, everyone. I hope I am audible. Am I audible?
Yeah, it is, but very low pitch.
Now, so it's fine.
Yes, good.
Thank you so much. Good afternoon, everyone. I am Gursimran Singh, Program Associate Spare India, and a very warm welcome to all of you. Thank you for joining us today's session. The fifth webinar in the series of Heatwave, Preparedness and Multi-Sectorial Approach for Resilience, being organized by Spare India Academy in collaboration with NIDM and Vatman Mahavir Medical College and Safdarjung Hospital. Today's today's session is policy forecasting and early warning, strengthening heat wave governance and preparedness. This session is important because heat wave are become more frequent and danger due to the climate change and urban growths. Many vulnerable people like children, elderly, senior citizen, and outdoor workers are at the high risk. We need to better planning, forecasting, and early action to reduce this impact and save the lives. With this, I would like to invite our moderator of the day, Ms. Tamanna Dalal ma'am, who is a senior researcher associate at the Sustainable Future Collaborator. And I now hand over the session to her to take it forward and introduce our speaker and guide us through the today discussion. Over to you, ma'am. Thank you. Welcome.
Thank you, Gursimran. Thank you for having me here. Thank you for the very detailed introduction to heat waves and why it is such a big policy concern. We've already seen that heat wave has had significant impact on public health, economy, and infrastructure in India. And the future projections of heat waves with them increasing in frequency, intensity, and duration are not just scary for public health, but rather systems in India overall. And it's highly important that we build our systems to be more resilient to the impacts of heat waves. So this is what we're going to discuss in the webinar today. Let me first, without wasting any more time, let me first invite the first speaker here, Dr. Jugal Kishore. Dr. Jugal Kishore is a leading public health expert with over 290 research publications and more than 30 authored books. He holds an MBBS from MAMC, an MD in community medicine from AIMS, and a PhD in psychiatry from the University of Delhi. Over the years, he has played a key role in developing departments and centers focused on occupational and environmental health and has organized over 100 conferences on urgent public health challenges. This makes him uniquely positioned to speak to the integration of heat resilience in health systems. Dr. Kishore, the health system is often the first to face the consequences of extreme heat. Um, what are some of the systemic gaps you see in the preparedness of the health system with regard to how it can address such a big threat? And what do you think is the key to sort of mainstreaming the solutions in the existing policies around heat actions in India?
Yes, Tamanna. Yeah, you can hear me.
Yes.
I have few slides, but we can start later on. First, to address your question that how health sector is important or playing a role in heat wave. Uh, Heat wave, rather any kind of disaster when they have some impact on human health, then it becomes important. If they are just causing some structural damage or maybe uh, you know economic loss, they are all repairable and can be managed. But when it comes to causing morbidity and mortality, then the concern of everybody is to decrease it and to remove it, and that is why it is important. So heat wave has become important recently because it is increasing. The temperature is increasing. for last 40, 50 years, we are constantly observing and start saying that it is going to have havoc and we should do something. But slowly we are also progressing towards, mitigation and some strategies to be resilient, making our structure and body resilient to whatever changes are occurring. But I was always advocate to prevent it. And time has come when it appeared that prevention has become difficult. And anyway, I still feel that if you start prevention today, maybe I think for next 20, 30 years, will be having much better effect as compared to just having the mitigation or maybe just a cosmetic changes to our life or becoming resilient to it. Because, how much resilient you can become when the temperature continuously increasing. So I'll show some slide to say that how and where we are actually mainstreaming. We have the plans and how the health system can mainstream whole thing. So uh, through the slides, I'll try to make my uh, statements clear. You can see my slide, first slide,
Yes, sir.
and the second one also.
Yes.
Okay. So we already know the climatic change occurring and we have diseases. And the first one is heat stroke. Or beside that, we have many others. And in heat, we face other problem also, which are there, but we'll focus more on heat related or sensitive diseases. And the heat waves itself is a disaster, which is having the health impact. And in that, there are a series of, effect on body and leading to heat stroke, which is a very fatal and causing death. So they are already, I think, circulated and everybody aware of, and that is the message they want to communicate, that we have the disasters and they have effect on health, and at the same time the climatic change is occurring, and which is related to whatever happening in the world or maybe on the globe. Now this is the one of the workshop where it is presented, and I just highlighting that few cities. And I remember 40 years back the Bangalore was totally green, and if you take 20 years of picture, you can see now it is almost red. And Hyderabad, you can see, although within Hyderabad, we have the big lake, but in spite of that, you can't see any greenery. Fortunately, Delhi itself, the green at this point of time, but very fast it's becoming, red. The reason is the number of houses and the colonies are increasing. I'm afraid that within maybe I think 10 years we'll have a different pictures, but such pictures are emerging and they are all showing the urban heat islands. And in all cities you can see, if we look at the whole picture of the of India, then definitely we can see that there are reasons. The blue color one, which is showing high, uh, very high hazards and the risk also. So both, if they are more, then it's a dark and a blue color, and redder side is a very high intensity of the risk, but hazard is less. So you can see that, yes, Rajasthan, Gujarat, Maharashtra, Uttar Pradesh, and also the Madhya Pradesh, they are, and Delhi is also part of it. And the area where it is actually emerging is some of the northeast state, which should have not been, because mainly, hilly, and that region could have been, saved, but unfortunately, it's not happening. And then you can see that at the same time, the mortality in those areas. So red color on the right side, you can see the picture of the India, which shows the mortality, high mortality years. So that can be easily superimposed and can be seen that more deaths are now recorded on those areas where the heat waves are quite high. the effect is not just immediate. Today, suppose we have a high temperature, tomorrow also, so it has the immediate effect. No, it have the long effect of maybe, I think you can have effect up to 1 month. So, that heat wave uh, will have on body, the effect which may be a little longer and may extend to almost 1 month. So that is also important when we look at, how much mortality will be there. And just fluctuation of the temperature is not, affecting day to day. Over a years, we can find the number of deaths are increasing, which are recorded, but unrecorded deaths are much higher. Or identifying the heat wave related deaths are also a difficult task for doctors. We know that how we are finding difficulty, but at the same time, when we look at that, some of the records by the government, they are still very less in number. But when it comes to the reported in newspapers, then the number is quite high. So somewhere we are not able to capture the number of deaths accurately. So that mechanism also required, and which is actually our area of concern in health sector. So these are the known factors or known areas where uh, heat waves affecting, and we should consider those all predisposing factors like the age, individual with disability, or people who are already taking medications, or having some kind of disease like diabetes, hypertension, or cardiovascular disease. So they have a calculated risk, and the exact calculation is required. And because the severity of these all things depend on their own severity. So what severity leading to effect of the heat wave on or heat on the individual need to be measured and calculated. So that is the area where we have to work on. Similarly, the people poor or homeless or outdoor, and which are quite high. Today also, if you go outside, you can find people are there on the road. And I don't know why, during this period only, the construction will be there. Then also, road construction will be in high, uh, full swing. And there, heat wave can definitely reach to very high level, because they have to melt the coal tar, and which is itself is reaching to very high temperature. So outside temperature and the immediate temperature is very high, so they are very high risk. So these are the factors which I have already said. Even the obesity and kidney disease, high blood pressure, they are all people who are alcoholic, or already having some kind of blood disorder like the sickle cell anemias, and already have some kind of fever. And the people who are on antihistaminics or diuretics or tranquilizers, stimulants, all they are actually increasing their risk of causing heat wave. Now, these are the conditions which are emerged, and it will start with anybody. I think we have discussed for last, 4 sessions. Our doctors has come and described that, how it will start. And that is very easy for remember that, on the skin, some kind of rash will appear. Then, some effect on the brain will be there. So giddiness and vertigo will happen. And then, some muscles cramp will start, swelling will be there, and then you will have the exhaustions where the fatigue, dizziness, headache, nausea, vomiting, cramps will be there, and then leading to stroke, which is very high temperature of the body, where leading to delirium and convulsions, coma, all these things will happen, and the person will die. So that's a sequence, and everybody, I think, even layperson should know these sequences and where they fall, and immediately they should recognize their own condition, and should immediately act upon. So that's the more we should promote and circulate to majority of the people. This is already
Sorry, Dr.
undergoing.
Kishore, would it be possible for you to wrap up in the next 2 to 3 minutes to sort of stick to the timelines?
Okay. So this is, I think, our thematic areas for actions in health system. Like we have if we talk about the cooling system of the building, so all health In system, we have you can start with the Health and Wellness Center. Then we have the PHC, Primary Health Center, the Community Health Center. We have district hospital and a major hospitals like the medical college and all that. All these buildings should focus on the space cooling, and that design should be in such a way. And then seeing that air conditioning technology is of advance, it should not be, break down immediately, or maybe in a every year you just keep doing it, like we are seeing on the other side of the roads and other. Cold chain and refrigerator is very important for us because of the vaccines, and if it is not working, I think our system will collapse. Same is our transportation of various chemicals and drugs that need to require air conditioning, so that is also to be streamlined. So the health system depends on many sectors, and many sector has to uh, you know join hand together to make the system very robust for the heat. Another one is refrigeration and air conditioning of the service sectors, like in the indoor wards and other areas of the emergency. Refrigerated demands and indigenous production is also one of the area where we can decrease many of the loads on us. Another one is early detection and prompt treatment, like vulnerability assessment, accessibility of the affordability. So they are all linked with our doctors are available. They are able to identify things. They are able to put the patient on treatment very fast, and then it is available. Poor should get the same kind of treatment as we know that how the rich goes to good hospital like the 5-star hotel, but poor still go to the places where even the air conditioning or maybe the cooler sometimes is not available. So the National Action Health Plan on the heat-related illness, which is already by the NCDC, is doing this capacity building of all health staff and health awareness program according to that. But more such kind of awareness program is required, where the community involvement is very important. Research and development is a very crucial component, as I've said, that finding out the more risk factors, how to remove those factors, or maybe introducing some of the interventions and seeing their effects, so that we can mitigate those all actions. These are all important. And then data related to this morbidity and mortality, how to capture by this IDSP or IHIP, which is already doing by the NCDC. But the heat related illness, if they are defined very well and every doctor is aware of or nurses are aware of, they will capture the data much better than others. Then risk assessment and assessment of the effect of intervention. So these are important areas of research. So mainstreaming, it means that what the heat plan is saying, that in health sector should be prepared for it. So the building, the staff, the logistics, then research areas, all are in a tune with handling the heat. So that is what is the mainstreaming. So that is all I wanted to. Definitely, these are already stated, that how you will prevent it, how you will mitigate, and that's all. I think that's the way you have to mainstream. Thank you.
Thank you, Dr. Kishore. If anyone has questions, feel free to drop in the chat. We can take it up in the last session on the open discussion. Um, Thank you, Dr. Kishore, for telling us the various health impacts of heat, and especially pointing out what are the key areas that need to be worked on to make the health system more resilient. You've very rightfully pointed out the fact that this needs to be a multi-sectoral effort, and various data points are needed from across different departments to truly have a more inclusive and prepared heat governance. This is now a cue to go to our next speaker, Dr. Arulalan T. He is a scientist at the Indian Meteorological Department with over 14 years of experience in numerical weather prediction and cyclone forecasting. He holds a PhD from IIT Delhi with a focus on heat waves over India and has worked at IIT Delhi and at NCMRWF in Noida before joining IMD in 2021. He accurately forecasted 14 cyclones with landfall errors under 25 kilometers, contributing to multiple zero casualty events. Dr. Arulalan, could you walk us through what the current forecasting mechanisms are in place for heat waves and how what are the gaps that need to be filled to make early warning systems utilizing this data to be more efficient and for them to reach the most vulnerable populations?
Uh, Good evening, everyone. Are you able to see my screen?
Yes.
Hello?
Yes, sir, we can see your screen. Can you hear us?
No, yeah. Are you able to see the full screen or like a kind of two slide?
We can see two slides on top of each other.
Okay, though I enabled full screen. Just, give me a second. Yeah. How about now?
Yes, perfect.
Okay, fine. Good evening, everyone. Uh, Due to the limited time, let me directly focus on the forecast, how India Meteorological Department is forecasting the heat waves and then issuing warning, early warning to all. So everyone mostly aware about how IMD made the definition for the heat wave. However, in a minute, I'll just quickly summarize. Uh, like we have different criteria for declaring the heat wave. If it is based on maximum temperature, the first criteria should be more than 40 degrees Celsius. Also, we have two subcategory or two different type. Either it's a departure from normal. Normal means it's a long-term climatology. Like from we used to take it like 1992 2020, that 30-year period, 40-year period, whatever we are defining, that average, and then we are taking the departure, or we can say simply the subtraction. If the subtracted value or departure or anomaly or whatever we used to call, if it is positive and then more than 4.5 T, 5 degrees Celsius to 6.4, we declare it's a heat wave. If it is more than 6.4, we declare it's a severe heat wave. If it is absolute temperature, then it must be a more than 45 degrees Celsius for heat wave. For severe heat wave, more than 47 degrees Celsius. If it is a coastal station, the criteria is little bit reduced, like maximum temperature should be more than 37 degrees Celsius. Also, the similar departure criteria for heat wave and severe heat wave applicable. If it is over the hilly station, then maximum temperature should be more than 30 degrees Celsius, and then the heat wave, severe heat wave departure as listed here, like a 4.5 and 6.4. And for a warm night, the criteria should be like the maximum temperature should be the 40 degrees Celsius, and then minimum temperature departure departure should be positive 4.5 degree to 6.4 for warm night. For a very warm night, it should be more than 6.4 degrees Celsius. So this is the basic criteria. And if it is the above criteria is met at least two stations in the meteorological subdivisions for at least 2 consecutive days, then in the second day we used to declare it as a the observed heat wave or observed warm night as it is. Uh, just to summarize, like how the climatologically the maximum temperature is shown here. This is the climatology of maximum temperature, which is shown in the very first figure. We can see that the maximum temperature maximum temperature for the March climatology. We can see that entire pen is like the maximum temperatures are varying from 32 to the maximum like 32 to 38 in the southern peninsula, whereas in April it has gone even up to more than 40 degrees Celsius, the core of the southern peninsula. Whereas in the May month, that 40 degrees Celsius is wide range. We can see that like most of the country, even the 42 degrees Celsius has seen the Rajasthan and then central India, which covering UP and Madhya Pradesh, also over the Telangana and Andhra Pradesh. Whereas in June month, that southern peninsula has been reduced because of the advance of the monsoon. However, in the northwest India, which is typically the Rajasthan and then central India, covers the more than 40 degrees Celsius. This is the climatology, which is the long-term mean. And whereas the heat wave days in March, the number of heat wave days in March is very less, like at least like a 1 to 2, most of the region, especially over the west Rajasthan region. Whereas in the April month, it is typically goes similarly like a 2 to 4, or like some isolated places or more than 6 to 8 also, especially over the Odisha region as well as the Andhra Pradesh. Whereas in May month, you can see that like more than 6 to 8 days, high heat wave days is observed. This is also climatology. Whereas in June, that has been reduced, but still, however, the similar number of days would be more than 4 days would be there. It's average. Whereas if you're taking like a seasonal, like a March to June, the entire heat waves, the average would be like number of days, like more than 8 days, which is shown in the red color, which is covering over the west, the western India, also the eastern India, coastal Andhra Pradesh and Telangana, and partially over the Uttar Pradesh and Madhya Pradesh and Maharashtra. The trend in heat wave frequencies during March to June from 1961 to 2020, the red color shows that significantly increasing trend. The frequency here, the left panel shows the frequency. The frequency keep on increasing, and the blue color shows it significantly decreasing. So decreasing is very less, which is shown in the like that Himalayan belt, also over the coastal Odisha region and West Bengal. However, the majorly we are seeing the frequency is increasing, whereas the right panel shows the trends in the maximum duration of the heat wave. Like a one episode could be like a 2 days or 3 days. So that in that way, how the trends are increasing, we can typically say that entire country the duration is getting increased. Hardly like one or two places is significantly decreasing. However, majorly we are seeing increasing trend in the heat wave days. And here we are shows that how like the teleconnection of El Nino or La Nina plays major role in heat waves. We all know that like during El Nino we used to get a have higher heat waves, but more or less in La Nina also we are getting similar kind of heat waves, especially over the coastal Andhra Pradesh as well as the West Rajasthan. In the La Nina phase, we are getting less heat waves over the central part of the India. However, the extremes of north, the coastal of Andhra Pradesh as well as the northwest Rajasthan, we are getting similar kind of number of heat wave days. And how IMD is issuing forecast or in what frequency. Like we used to issue the like initially we used to issue the seasonal forecast, which is like a lead time of or validity of 1 to 3 months. Every month the beginning we used to issue what is the next seasonal forecast or next 1 month forecast. Then extended range forecast, once in a week we are issuing next to 4 weeks forecast. And then medium range forecast, every day we are issuing the next 7 days forecast. Also short range forecast, which is valid for 1 to 3 days. So these forecasts being generated and then issuing these along with the impact based warning to the MHA, NDMA, SDMA, and then all the district authorities, health department, agriculture department, the Indian Railways, road transport, press and mass media, and also to the heat action plan authorities at a city level, district level, state level. Nowadays we are issuing you on the village level also through website, email, common alert protocol, which is a WMO standard, and then WhatsApp, Facebook, Twitter, whatever the way we are able to communicate, we are communicating this. Also, how we are monitoring IMD as a big network of surface observatories covering the entire country to measure various meteorological parameters like temperature, relative humidity, pressure, wind speed, and direction. all of them playing a role to forecast the heat waves. And based on daily maximum or minimum temperature stations data from the climatologically, as I mentioned, which is prepared from 1991 to 2020, on a given day, the temperature and other parameter are compared with the pentadal normals. And then if it is deviating, how much it is deviating, then as I mentioned that formula will be applied. Then we can declare the heat wave forecast or warm night forecast can be easily predicted. So IMD is running like a 7 numerical weather prediction models. From India, we used to run 3 to 4 models, and then from internationally we are adapting, downloading under collaboration another 4 global models. So we are taking the multi-model ensemble mean, and from that mean we are issuing the forecast for the heat wave for next 7 days, also for the extended range next 4 weeks, also for the long range for a seasonal that has been issued. Also, we are issuing the impact-based forecast in a color-coded form for people to understand very easily and take necessary action by everyone. So this is yesterday's Thursday. Every Thursday we are issuing the next 4 weeks forecast. This is the yesterday forecast has been issued, which is the week 1 maximum temperature, the average maximum temperature for the next week. We can see that that Northwest India, the maximum temperature would likely low, like 43 to 45 degrees Celsius. Whereas in second week, like valid for 20th June to 26th June, it has been reduced, like you can see up to 42 degrees Celsius. Whereas third week, it's completely reduced because of the onset of the monsoon, which I did not show here what is the rainfall, but from figure itself we can understand this maximum temperature. Similarly, the week 4, and here it is mentioned how much it's a departure, how it is departure from the model climatology. The week 1 shows that departure is like up to 4, like a 4 to 5 degrees Celsius, whereas week 2 it is giving only like a positive 1 degree Celsius over the Northwest India. So which means, so maximum the next 1 week will be having the very warm or very warm condition or heat wave condition, whereas the second week will be reducing, it will be reducing the heat wave conditions. And finally, the objective of impact-based forecast, we are issuing all the warnings in a color-coded. As I mentioned, like IMD issuing color-coded warning for multiple meteorological parameter along with its impact-based forecast. Green color means no, there is no action is required from anyone. It is just a normal regular day. If it is yellow alert means it's a heat alert, heat wave conditions or at isolated pockets. Plus just for 2 days, then moderate temperature would be there, and then action also being suggested: avoid heat exposure, wear lightweight or light colored, loose cotton clothes, cover your head, like kind of action suggested also you should. If it is orange alert, be prepared for the severe heat wave condition or severe heat wave for the day. Then this is the second day, like it's already occurred, the second day we are issuing. And then the corresponding action also mentioned, like avoid heat exposure, keep it in cool, drink sufficient water, even if it is not thirsty. Likewise, the action has been suggested. If it is a red alert, then it's a extreme heat alert for the day, and which means a severe heat wave conditions, and then extreme care need to be taken for the vulnerable people, those who are directly exposed to the direct sunlight. So accordingly, these has been prepared in a day-to-day from IMD using decision support system, which internally IMD has been developed using GIS tool. The multiple operational tools has been developed. For example, this is issued. The first 3 is issued for the based on today's forecast. It's valid for this panel is valid for today. What is the color code shows that there's Northwest Rajasthan and East Rajasthan, and then Punjab, Haryana, given the heat wave or severe heat and then severe heat wave condition, also over the warm night condition. For that, red alert has been issued for the day 1, and day 2 also persist, but day 3 it has been reduced to orange color. If you see that over the Bihar and then Assam, Meghalaya, Arunachal Pradesh, we have issued the hot and humid condition, where that moisture is there. Also, the heat condition also would be there. So that will give the discomfort to the common people or who were exposed indoor or outdoor. So the corresponding hot and humid condition warning has been issued, even for the Gujarat, for the day 1, day 2.
Sir, could I ask you to wrap up in the next 2 minutes?
Just next 2 slides. So IMD is issuing color-coded impact-based forecast warning for the heat waves, and then we are issuing for uh, sectoral-based heat wave condition, heat wave warning like heat wave plus health, how that the corresponding impact would be there, and for the heat wave plus agriculture, how the impact would be there on agriculture. Separate heat wave warning has been issued for agricultural theme, and for the forest fire, also for the transport and all, we are issuing dedicatedly heat wave condition on the railway track, also the national highways, how that could be particular highways or a track would be exposed to the heat wave. Also for the heat wave plus solar energy or wind energy, how that will impact. So this IBF requires a domain expertise from specific sectors in addition to the what IMD is being produced, the forecast. So it has to be a teamwork, then we can make the very good effective forecast, which will be taken, the most of the action will be taken by the specific administrative people, even the common people. Thank you.
Thank you, Dr. Anand, for the very detailed presentation. I think it's quite important for the state, especially to know when to start preparing for a heat wave, and the seasonal forecast by IMD have been truly quite useful in that sense. But a broader area we need to think about is how to leverage the new technologies that are coming up to build resilience within the society. And that is the cue to invite the next speaker, Mr. Omkar Khare. He is the director of Resilience AI and an international civil servant with over a decade of experience supporting governments during disasters. His work spans education, nutrition, WASH, health, and social protection teams, focusing on last mile service delivery. He has advised senior government leaders, including chief ministers and senior bureaucrats around senior officials across Indian states. At Resilience AI, he leads initiatives using artificial intelligence to map heat vulnerability and design adaptive strategies for high risk settlements. Mr. Omkar, from your work within Delhi and using AI, what are the key lessons that can be taken up and scaled up within the country? And what do you think are the key gaps that emerge?
Thank you, Tamanna. Just a correction. I was an international civil servant. I am no more in that role. So that is when I was a UN staff. So okay, so what we are working as Resilience 360. We are working on a couple of models which can AI models which can be deployed for 6 disasters. We will be looking at heat today. So I'm sharing a small story, a presentation which tells the story of Delhi, because this was done in Delhi. There are many other things, but this will give a brief insight of what we do. So most of us know most of this, we are, as a country, we are going through we are urbanizing very fast. We have these heat islands which are created, like the previous speaker, gentleman from IMD rightly said, all the heat forecasts and all, they are coming, and IMD has been very critical in giving those forecasts from time to time. And surfaces where surface temperature is increasing continuously. And now what all that is causing is mental health issues, respiratory problems, skin problems, heat exhaustion, all of these things. We all know it. One of the key things which we also see is we don't have a very solid mechanism in the public health sector within the government to say, okay, this death was a heat wave death, because it is a heat induced death, but the death certificate will not say that it's a heat induced death. So that problem is also pretty rampant, which we are seeing now as this problem is getting serious. So that will cause, I'm saying this because then we can't, as a country, we can't provide the ex gratia like we provide to the other disaster deaths or fatalities as per the NDRF norms. So Coming to what we have done, like we focused, I mean, when I have worked personally in Odisha and Maharashtra, Nagpur and parts of Odisha on heat, and what we used to see is the guidelines that we could issue, I mean, government could issue, used to be stay at home. Like school timings are changed, government timings are changed, and a lot of people, children, everybody stays at home. Now, when you stay at home, you feel it is safe. But what was being discovered, particularly in vulnerable communities, that the inside the house temperature is sometimes more higher. Like if you can see the third point, indoor temperature is 47 degrees Celsius, whereas outdoor temperature is 44 degrees Celsius. So this problem started coming up, and we did start as a disaster management community. We did start speaking about this a couple of years back, and we are now heading towards addressing that issue. What we do is, like, if you see the picture on the left, it's a simple satellite image with high resolution map. It gives us the temperature, it gives us the type of roof. So there's a tarpaulin roof, which can the AI model will recognize. There's a concrete roof, there's a thatched roof. Every roof will be recognized. There are some 20 different types that the model can recognize. Now, based on that, based on this coupled with the IMD's model, IMD's, heat wave warnings, which they give out from time to time, and they're very apt. These two getting together, and there are 23 different parameters which we look at. And then with in coordination with, the expertise that we have, and also in this particular project, there were DDMA Delhi and NDMA, they were involved. So in consultation with them, we figured out, okay, so these will be like 5 categories of risk. So here you can see 3 categories: yellow, orange and red. So red and orange are obviously high risk. So this was identified sitting in a room. This took 8 hours. The whole model it ran, and 6 degree hotter than the cities outside, than the other, the overall temperature. So this was higher. This was recognized by an AI model. So originally the plan was, the local authorities were thinking, or there were other agencies, multilateral agencies coming in and thinking the entire area should be taken and every house must have a cool roof or something like that. But this model came in, we ran it, it was proven. There was a lot of ground truthing which was also involved, wherein people went to households and, not every household, but sampling basis, went to households, took the temperature, and accuracy was about 96%. So proven, internationally published in Elviser, we have 96% accuracy, which was achieved. Now, once this was done, this model has other things also, which it works with other hazards like floods, slope, landslides, tsunamis, and we'll not get into that. But now this AI based model is basically for heat wave. What we did in short, there were geographical factors, there were roof type classification, and based on that, risk scoring. So low, medium, high, these were the broad 3 risk scoring which were there. And next step becomes critical, the intervention. When it started, there were 5-6 interventions. The first one, and most effective in partnership with the DDMA there, was these 3 types of roofs, 3 models of changing the roof. So we did not go for changing the complete roof, because that would again be cost intensive. So there are existing CGI sheets. The CGI sheets are the corrugated metal sheets which are typically used. Then there are various layering are done. So in model 1, where temperature is it is 12%, 12 degrees Celsius cooler, we'll have a tarpaulin sheet, we'll have the existing CGI sheet, the insulation foil, a polystyrene sheet, a bamboo sheet, and a bamboo framework, and a jute sheet. So this could achieve less than 12%. The second model could achieve less than, more than, the temperature was lowered by 12.7%. The last model, temperature was lowered by 8.5 degrees Celsius. Now these are which model to, again, the cost varies. So which model to use where was decided by the red, yellow, orange, or green. Green households were not seen. Risk is low, high, or medium. So the model which was used for roofs was selected by the kind of color that the model assigned to the household. Second was putting sheets on the street. Like you would know this, we also did in Odisha, where streets are covered with green paper, green sheets that lowers the temperature to a certain degree. Then wash intervention was also introduced, where safe water was made available to the people in the community in Vivekanand camp, where our intervention was done. The seeds was also involved while doing this. Then there is behavioral change. So these are NDMA standard guidelines which were followed, like using white paint inside the house, staying indoors, seeking shed whenever you feel required and you have to work outside of the house, hydrating yourself. Dietary habits should be changed and increasing vegetation. That is more of long-term this thing. Then developing early impact system, wherein now this was, again, since the government was involved, automatic weather station was installed in the area, temperature was recorded, monitoring was done in a more timely. This is all last season. Monitoring was done. Local volunteers with it. Now what happens is a lot of time warning goes through the cap. Warning goes, people get SMSs on the mobiles, and we see people don't know how to react. Okay, it's a hot day. They will see घर से बाहर मत निकलिए, वो समझ जाएंगे, but people may not be able to always act on the warning which has come into their mobile as an SMS. So for that, community volunteers were mobilized. IMD sheets were, I mean, the colors that IMD publishes, people were told that how to use it, how to read it. So this kind of awareness was also built. And this overall, then after that, AI based risk assessment, the overall combating heat intervention, we call it a frugal intervention because it was all basics. Heat is a silent killer, but it can also be combated easily. So that's why we call it a frugal intervention there. Snapshot of the types of roofs. This is the first picture. You see the insulation sheet being installed. Second picture, the cardboard and bamboo framework being installed. Third picture, again, the aluminium insulation foil was installed. So this kind of things were done based on the risk that the house had. Now, reimagining the heat measures, basically, we need a comprehensive approach, which we are now working towards because heat is increasing. There are multiple, I mean, staying indoors is not always safe. Sometimes it is safe, sometimes it is not safe. The communities also need to be, they are facing the brunt, but they also need to be more, have more capacities to be able to respond properly. Like we have the NDMA program of Apada Mitra or, other community-based DRR programs. So this risk, granular risk, which we calculate, we are now aiming to link it to community action, because only when these two talk, we'll be able to make our communities safer and more ready to be able to respond to heat. So that's all. If we can have a discussion as and when time permits. Hope it was useful.
Thank you, Mr. Omkar. That was extremely useful. And I think commendable efforts on sort of trying to put knowledge around where the localized risks are when it comes to heats and sort of putting that into government frameworks. Now, the question that usually a lot of thinking around solutions leaves me with is how does the state actually scale them up? And that is the question about financing of these solutions and many other solutions required at multiple different scales. That is currently missing and inadequate. So to sort of talk about the financing of heat actions in a efficient way, I invite Mr. Vishal Pathak. He is the senior coordinator at the All India Disaster Mitigation Institute, where he leads the organization's national efforts on heat adaptation and mitigation. He also co-leads the Learning Lab on extreme heat solutions with the Asian Development Bank. Vishal, from you, I wanted to know, what are you thinking about how to finance a heat action plan or heat actions in general? Where does the money lie? How do you use currently existing streams of money within the state and with the private sector to more effectively increase heat resilience in the community?
Thank you so much, Tamanna, and also my sincere thanks to all speakers and organizers. Very big and important topic. Finance is always very much fundamental requirement for our action, and some of these points many of us are aware. Before that, let me just share briefly that what we are, who we are, where we are. So this All India Disaster Mitigation Institute, we are community-based action planning, research and advocacy organization providing policy support work based on our response to 18 types of disaster. And since last 4 to 5 years, we are more and more spending our energy, resources into heat wave, and particularly with the vulnerable population, how adaptation can be done with them and what are the mitigation measures can be done with them. So for us, it is like one side, it is humanitarian action, and one side it is also about the disaster risk reduction, and one side it is also adaptation to climate change. So we are promoting and strengthening this convergence between these three thematic areas where AIDMI is working since its inception since 1988-89. Well, part of it has been shared that very much, we are facing very much high loss and damage when it is about, extreme heat. But on the other side, who are more and more vulnerable, and for which are those groups with whom we need to spend more and more money is, the country has already lost over 259 billion labor hours annually since 2001 because of extreme heat. In terms of agriculture point of view, we have lost 15 to 20%, and in milk production dropped by 15%. This is the data from 2022. Now, there are, as in the beginning, it said that the death we have not able to calculate it, but same way, there are a lot of loss and damage we are facing, but not counted. On the other side, thanks for really good efforts that has been made in last 10-15 years, which helped us to reduce death toll from recorded point of view. But on the other side, our risk, our efforts for reducing risk is much less than what the speed of increasing risk because of extreme heat, and that require much more finance, much more integrated approach on the ground across the system. Same way with human and economic cost. Now, as already in the beginning, Dr. Kishore already mentioned very much, clearly about the health impact. And we also aware about the loss and damage. Now, see, if we're talking about small businesses, just let me share with you some figure that in India, it is 40% GDP contribution coming from these small informal businesses, and they are employing very high portion of Indian human. And for them, it is their health is their asset. And that is very much exposed to extreme heat. Now, what we can do, what our planning, what our finance is reaching to them is very much important. They are the backbone. We have made some progress, really concrete, really useful, really, very much specific after this successful Ahmedabad heat action plan. Now we have more than 40 cities with heat action plan, and there are not all of them with the implementation, but some of them really, making very good progress in terms of implementation. They are also reviewing and updating their HAP. Biggest point is about the finance. What are the finance mechanism that's at city level, at district level, at state level, they are exploring. Fortunately, since last 2 years, some progress has been made. For example, Madhya Pradesh state has been announced heat as a local disaster. Same way, Tamil Nadu also announced heat wave as a disaster. So that's really make big step. Of course, it's require more steps, but once we are announcing it disaster, that's make a big, open up for this financial requirement window. There are thermal adaptive houses that has been explored, pilot projects has been made, the use of traditional materials blended with modern design to maintain coolness. So these efforts has been made. Also about the cool roof pilots in Ahmedabad and Delhi, and there are other couple of cities that has been made. Now, here, these are the good example, good pilots, but also important to see that how these pilots can be upscale, wide scale more, and these require have linked with finance. Urban very much concentrate, very much recognize in terms because of course it is exposure and it is also need. In urban areas, the heat island effect amplify temperatures, city need cool shelters, shaded public spaces and water points. Implementation needs to speed up. Funding shortfalls also exist because that heat is not a national recognized disaster. In rural India, outdoor work in farming and herding makes people especially vulnerable. Productivity losses from heat are already affecting food security. However, rural pilots, for example, in India, in Bangladesh, prove that low-cost solution can succeed when funded and supported. So there are some cases are available now, fortunately. Important lessons for us. Several key lessons emerge. First, heat action plan needs dedicated budget lines. Without financing, even the best plan remain on paper. Second, these plans must include public participation and social audits to ensure accountability. Third, recognize the heat wave as a disaster, unlock access to disaster funds. There are several points that has been made in the last 2 years. Fourth, we need to blend public, private, and climate finance through mechanisms like public-private partnerships. Now, there are CSR projects and pilots ongoing basis. It is also increased. Now, how those funds can be linked with extreme heat, adaptation and cool solutions, that's need to work out. And finally, accountability must be built through measurable milestones, vulnerability mapping, and real-time monitoring. For example, now we are saying, and it is very good progress that now we have heat action plans. Number of cities come out with app. On the other side, how many of those link with the finance? So that is our, important step, and we must not take much time and need to done as early as possible. At AIDMI, being a small organization, we are doing some pilots to generating evidence and also sharing strategically with decision makers and other practitioners and researchers. One point we found that, as said, small businesses, they are very much important in our economy, in terms of local economy, in terms of local disaster recovery, whether it is flood, disaster, because when we say extreme heat, on the ground level, it is also many times it is co-location of hazard. In a 1 year, this population also facing heavy rain and micro level flood or urban flood, and in the same year, they are also facing heat. And heat affecting their monthly income, and that is not counted anywhere. We do not have that mechanism so far. So localized heat action focus is also required. Capacity building and action research is also important area. We are emphasizing. Fortunately, as said, we have IMD who is providing 7 days forecast to extreme heat and really useful. But here also need to, understand, consider that access to early warning is important. On the other side, understanding of extreme heat early warning is also equally important, and that require much more, investment in terms of soft capacity building aspect, which needs to be looked out urgently. There are a number of stakeholders there on ground level support, number of CSOs, and these CSOs can work, very good. They also have made some very good pilots, but how those can be, supported with this extreme heat through city level engagement, through HAP and other platforms, it is also required. There, AIDMI recently done this in terms of demand, and we have found that each and every sector is linked with, cool solution market. It is challenging. On the other side, it is also opportunity for us that what measures, what evidence can be, generated in coming years more and more in terms of capacity building needs, in terms of management and planning, in terms of required behavior change for extreme heat. It is very much important. And so there are a number of such sectors. There are a few takeaways looking at time. In summary, heat waves are no longer rare events. They are a public health and economic emergency. Financing must go beyond relief to support long-term, locally led adaptation. Accountability requires community monitoring, legal mandates, and transparent budgeting. With strong plans and proven models like Ahmedabad, and with civil society actions, we can scale a heat resilient future across India. The time to act and invest is now. This is really, very short and quick, but I'm open for any discussion. Thank you.
Thank you, Mr. Vishal. Thank you for opening up the discussion on heat action plans and their underfinanced nature. I remember from a study we did around heat action plans, we found that only 2 of them mentioned any sort of tangible financial instruments to sort of implement the solutions listed within them. Another thing that heat action plans considerably lack on is sort of identifying who are the most vulnerable people on ground and what sort of mechanisms are required to truly cater to their very specific needs. I would now like to bring upon the next speaker, Mr. Abhishek Kumar. He is an environmental lawyer and disability rights advocate. He's the founder and curator of the Sangyan and has been a fellow of the NCPEDP Javed Abidi Fellowship on
Manish bhai, 2 minute Joseph.
Okay. As a person with visual impairment, he brings lived experience and deep policy expertise to questions of inclusive governance. He has worked with the UN India, UNICEF, UN Women India, and represented India at the 18th International Conference on Community-Based Adaptation. Abhishek, what does meaningful inclusion in climate and heat policy look like for you? From your own experience, what do you think are the current gaps within the policies, within heat action plans, and what sort of engagement do governments then build upon with the community to sort of cater to the needs?
Yeah, thank you, Tamanna. Good evening, everyone. To begin with the how the inclusive policy design is integrated into the Heatwave action plan, let me first give the context that how it acts as a Heatwave acts as a killer, endangering all aspects of India's sustainable development goal targets, and it causes a lot of not just deaths and health crisis. It also causes the concepts like disability adjusted life years, where the cost of living, the quality of life, and eco anxiety, accessibility anxiety is get triggered by heat wave. And using this infographic, I would like to show that how it disproportionately impact from the other population segments of population, because person with
Checkbox में question आ
yeah, because person with disabilities being a vulnerable communities for these 3 scientific reasons. First is they are having greater exposure, then higher sensitivity, and their lower ability to adapt and mitigate and become resilient to heat wave impacts. And it affects all aspects of their life, from be it losses and damages of their assistive technologies and devices, their cost of living, their menstrual hygiene, the violence gets more during the heat wave seasons, their mitigation plans, they are more vulnerable to abuse, exploitation, and so on, and which this infographic kind of give a summary about. Also, climate change induced heat waves has a multi-order effect that have immediate, short-term, medium-term, and long-term impacts, especially on person with disabilities, despite them not contributing much to the climate change and the disaster management or the heat wave tragedy. Because heat wave acts as a threat multiplier, and because of the laws and policies are kind of eco-ableist, where they don't take into account the person with disabilities, and because our disaster management act, which also doesn't recognize heat wave as a national wide disaster, came in 2020, 2005, while the rpwd act came in 2016. So there much of legal gap between the two legislation to cover for disability inclusive heat wave action plans. Going forward, these are the couple of case studies from across India where women with disabilities that I have interviewed with, and how they suffer. They have to migrate from, let's say, NCR to their other to homeland, become a climate refugee in sense. The second person has to face climate anxiety, that how they are going to work, and how they are to get their medical conditions in check, and how they will travel and so on during the heat wave for their work, and how that impacts their livelihood, their mental health, and so on. So going targeting the main core principle of today's presentation, that what is inclusive policy design. So the core principles of it is of having a representations of not just person with disability, but every sections of society, or not just the population, but also the ecosystem of also the other species, intergenerational species engagement in this heat wave, regarding as somebody mentioned, the economic aspect, the agriculture aspects, and so on. The second thing is universal design, that I will explore later on. The third is intersectionality, that how any community is not just one homogeneous identity. So for example, I will explore this further also. Also the co-implementation, it should not be like just they are part of some the implementation at the policy level, but not at the implementation level. So it has to be top down as well as the bottom up approach, where the person with disabilities, among other vulnerable communities, be it children, the senior citizens, they have to be part at every aspects of this. And inclusion and accessibility across the policy and planning level, communication level, response, monitoring, assessment, and as Tamanna, the other speakers talked about the budgeting. So they need to also have a dedicated budgeting with respect to. But what acts as a barrier in this inclusive policy paradigm? So first is physical barrier, because the infrastructure is not accessible for different types of person with disability. There are no ramps, there are not tactile paths for person with visual impairment or people using wheelchairs, and so on. There's social barrier, there are so many prejudices and stigma and shame and isolation, or not even in getting invited or into this policy framework, and so on. The third is institutional barriers, be it linguistic barriers, or the policy, the procedures are not very inclusive, or the needs of person with disabilities. There is no understanding of things called universal design, or kind of reasonable accommodation of person with disabilities, and what does even disability mean by that. And there's also communication barrier, which will deal further, because there is a lack of braille, signages, and interpreters in most of the platforms. First of the is that how person with disabilities are terms at a homogeneous identity. They are just treated as one identity, while there is both horizontal and vertical diversity among them. So be it the children with disability, youth with disability, women with disability, senior citizens with disability, migrants with disability, they will have a different requirement of their own. And also earlier there used to be only 7 recognized legally recognized disabilities, which is now 21. So some are hearing impairments, or visual impairments, some are blood disorders related, some are with respect to wheelchair users and so on. So there is homogeneous identity from the perspective, where the whole community of person with disabilities are treated one, and kind of a straight jacketed formula, so treat everybody as the same, and that kind of makes it more exclusive for many sections of person with disability community. In the legal framework, although the RPWD Act, National Disaster Management Plan of 2019, and thanks to NDMA, they also came up with disability inclusive disaster risk reduction guidelines of 2019. So though they do talk about some of the protections and what needs to be done during various types of disasters. However, there's a two basic gaps. Firstly, there's a making policies a very good thing, but at the ground level implementation, they don't even have the data which is mandated under, for example, Section 8 in DDMA is mandated to have data of person with disabilities, but the majority of the places they don't even have the data for the effective implementation. Secondly, they again treated the whole disability sector as a one community, and thus missing the different requirements of the different types of disabilities. And the third major missing is kind of the heat wave, given it is not that nationally recognized disaster, so it is often just mention of personal disabilities and they kind of moved on. So there is not understanding of how they can be integrated at the all levels of this heat wave action plans and strategies. The next, what shall be done is having universal design principle. So what this principle basically means is designing basically building, products, environments, our city planning, programs, services for use for all sorts of user, and it has its own principles, like it has to be equitable use, it has to flexible in use so that a large population can be used. And it is very important to understand that when anything is made accessible for person with disabilities or senior citizens or children's or pregnant women, for example, it basically means universal accessibility, that it is accessible for everybody, everyone can use that. So it is the kind of lowest denominator that serves everybody. Some good examples or some things that can be done. For example, Election Commission of India brought this assured minimum facilities that not just acted in preventing heat wave during the last year general election, but it also helped senior citizens and person with disabilities in accessible voting for them, or also the pregnant women. So those kind of efforts can be done. And with respect to that, it has to be more perceivable what are the needs of the person with disabilities and other vulnerable communities. It has to be more operable. It has to be more understandable that what is their requirements, and more better implementation, robust implementation of the same. Another example that I would love to give is of the Sachet National Disaster Alert Portal. It has a very good early warning systems, but what it lacks in, firstly, it doesn't give the alerts in sign languages. So a lot of the people who are deaf and with speech impairment and listening impairment, they can't use this platform. And also many of the person with visual impairment, the low vision or blind people, they can't use because this app or the platform is not screen reader friendly. So this acts as a very great resource for early warning system, but it needs to be added more. I really love the how it has been linguistic accessibility of covering into 12 languages, but hope more accessibility, it is made more accessible for person with disabilities. Further going, these are the last slide. So what needs to be done is that how the principle of leave no one behind and nothing without us. So it is not just leaving person with disabilities is enough. It is also important that they are kind of participant and representative for their own community at the general or general population at large, because in Indian context, it is estimated at the global level also that almost 16% of the global population is person with disabilities. Although as per the old census in India, it is just 2-3%, but that data will be increasing multifold because of RPWD Act coming in 2016. The second approach is how we need to have locally led and community-based mitigation, adaptation, and resilience based on the principle of universal accessibility and universal design. The third is how we need to have early warning systems, as I gave the example of Sachet app, and such alert systems and early warning systems had to be more universally accessible for people with different types of disabilities. Also, in the case of evacuation, on rescue, and so on, there should be provisions for regional accommodation and caregivers. So many of the persons with disabilities, they require caregivers, specifically for women with disabilities, uh, because they may be abused and exploited in such a kind of disaster situations. The fourth is the climate risk insurance and dedicated budgeting. Many people address the budgeting issues. So personal disabilities are further more marginalized in the budgeting instance. And also the personal disability, not just their health, because of their disability, no private or at the policy level, they may provide the insurance for personal disability, but in practice, most of the insurance policies doesn't cover disability, and even if they are covered at rare moments, they don't allow the claim to be passed. So climate risk insurance and the heat wave related insurance for personal disabilities is required. And then inclusive built environment, be it our urban planning system, our transport systems in the heat wave oriented, our mobility, our communication, all needs to be kind of made universally accessible and inclusive for person with disability. The next is nature-based solutions like the mangroves and the vernacular architecture, which can be kind reduce the heat wave impact, the heat island kind of concepts that person with disabilities can adapt and mitigate such challenges. So in that context, we need to explore and kind of have the convergence of nature-based solution, vernacular architecture for the disability inclusion as well. The fourth is another is digitally accessible infrastructure and assistive devices and technology. So a lot of the person with disabilities are not digitally literate in that sense that they are using early warning systems over social media or some other such things. So there should be there made be more digitally literate, and how they can access early warning systems using social media, and how their assistive devices and technologies can be also provided after the rehabilitation or such process, where the losses and damages because of the heat wave and its other integrated disasters causes caused by them. Further, disability specific standard operating procedure. So we can't just have one standard operating procedures and protocols, what to do and what not to do for all aspects of disability in respect to heat wave. So we need to have a dedicated SOPs and protocols for heat wave impact on, let's say, person with visual impairment, heat wave impacts on person with blood or disorders, and so on. The next is also, as RPWD Acts mandates the District Disaster Management Authority to maintain disaggregated data. So we can use the GIS-based anticipatory measures, and how having the real-time data, not just the data of how many people live there and how many people get kind of died in such a crisis, but also how we can use the real-time data for their better evacuation and so on. The third last is also disability inclusive risk and vulnerability assessment. So a lot of the time the person with disabilities are missed because they are kind of not on the face, they are not seen in the society, they are almost living in their homes and out of our sight, so kind of out of sight out of mind kind of syndrome happening with them. So in that context, their vulnerability and risk assessment need to be done by the government, so that in the context of any heat wave players and crisis, they can be addressed at multi-pronged level. Further, Indian knowledge systems and the indigenous traditional knowledge, for example, how the tribal communities and so many other, like the bamboo infrastructure in the northeast, on I'm from Jharkhand. Here the tribal communities use forest products as a adaptation measures, so many things, so many local drinks for the heat wave resilience. So those kind of knowledge education system and so need to be promoted, that of inclusive of person with disability. And the last, as another speaker also mentioned, the frugal intervention and the nudges for behavioral changes, that how this mitigation, adaptation, and resilience can be made part of, because there's so many taboos and stigmas attached with person with disabilities. So how through the nudges and such small scale intervention, cost effective intervention, those disability inclusion can be mainstreaming in a very gradual and evolutionary and a normal way, rather than kind of uh, uh, by force. So that's kind of my submission. Thank you. Over to you, Tamanna.
Thank you, Abhishek. That was truly useful, and I think this is a perspective that's currently missing when it comes to heat waves and the conversations around it. Also, thank you very much for the very useful last slide where you give very pragmatic and sort of easily implementable solutions to deal with this issue. What also came out of your slides was the fact that solutions for heat are will demand something that has to be done across levels. You have to have solutions to mitigate heat outdoors, indoors, as well as at workplaces. And the sort of scale that this issue demands has to be taken up by the state, because that is where most of the expertise and the resources lie. And that is what brings me to this question of how do you then institutionalize a heat wave preparedness measures and solutions and the various frameworks in a way that sort of takes care of not just dealing with heat waves currently, but also preparing the community for the future heat waves that is supposed to face. To answer this question, I would now like to invite Dr. Shiv Narayan Sidh. He is assistant professor at the National Institute of Disaster Management. He currently leads the Environmental Risk Management Division, as well as the Center for Forest Biodiversity, Disaster Risk Reduction, and the Center for Hill Area Disaster Risk Reduction at NIDM. With a diverse professional background, he has served as the nodal officer for Rashtriya Uchcha Shiksha Abhiyan in the Department of Higher Education, Uttarakhand. His core research spans forest governance, gender, climate change, food security, and community-based natural resource management. At NIDM is currently spearheading two major initiatives. The National Program on Climate Change and Human Health in collaboration with NCDC, and a project on disaster management plan for the Ministry of Ayush. Dr. Sidh, if you could speak about your experiences working with the government and how do you see and envision sort of institutionalizing all these measures that we've talked about today.
Hi, thank you, Tamanna. Good afternoon, everyone. I hope I'm audible.
Yes.
Yeah, hi. Let's say we are in middle of a severe heat wave, right? And I hope everybody is well hydrated. Yeah, keeping it cool. And is the city ready with the heat action plan? So we have a policy framework, we have models, but have actually have we institutionalized in a decentralized manner where we could say, okay, we are ready for the any heat emergencies. Okay, let me pose a question here. Is heat problem of India or a more cooler climate people like Europe? So in a way, recently heat action plan and heat has taken a center stage. In a couple of years back or 5-6 years back, in Europe, a lot of people died because of heat, excessive heat. But that was less than 40 degrees. In India, 40 degree in northern India and Indo-Gangetic belt is any normal working day, and we normally do not pay heat much of to 40 degrees. Now, let me come to the problem where we are. Why are we looking at heat as a problem, and heat, particularly felt heat? And I am so sorry that I did not listen to previous speakers. I'm not sure whether they have dwelled upon these ideas. But let me just, has anybody, Tamanna, could you please respond to this? Has anybody introduced heat wave or defined heat wave?
I speaker from IMD did speak
okay.
about it, yes.
They have done it. Okay. So I don't need to repeat that. Okay. So now let me get into some of the experiences. I won't be sticking to the definitional aspect. but there is one word which is muggy. In geographical literature, we have a muggy. Muggy is extremely hot and climate with very heavy, very high humidity. So that is the concept of felt heat. So nowadays we are looking at the night temperature, and minimum temperature is shifting up and maximum temperature is already shifting up, and there is a deviation from the normal. And new normals are set up every year. We have and last over last 20 years, we have 18 years which are warmest of the last century. So every year we are inching up higher and high. Reasons are just not the climate change. That is one part. Part is also the way our cities are designed. The way our city, the population is increasing in cities. At the moment, India is roughly around 40% plus population is living in cities, and it is going to increase over the time. And so similarly, being a tropical country, we have more, cooling and energy need requirements is also there. Vehicular density is also there, and this will all affect and create a heat island impact, coupled with the pollutants and aerosols. So let's have the look at the impacts of the heat wave. One is health risk. So it increases the morbidity. Morbidity could be linked to then later on mortality. And in heat impact, the transition from morbidity to mortality is sharp. In a days or couple of days, person is no more. So it creates health risk hazard. Second, heat related illness. So heat exhaustion and heat stroke. And when I look at my own childhood background from Rajasthan, loo is one common word that's called heat stroke, right? There are traditional methods and ways to keep yourself hydrated and uh, heat loo free, but then heat stroke creates that trauma. Then high temperatures can worsen the people with existing comorbidities such as cardiovascular and respiratory diseases. Then there is prolonged exposure to heat can cause dehydration, kidney stress, and mental fatigue. And this is more in people with exposure to the heat, to the vulnerable groups such as pregnant women, elderly, and children, even women in working in the kitchen in the house. Normally, kitchens doesn't have fans. They are also exhausted because of the excessive heat. Then it creates heat. Excessive heat creates ecological stress. So water stress, and there is no second thought about that. India is a water deficient country globally, and our per capita availability of water is lowest among the global, southern country, global south. I cannot compare with the European, some of the European countries which have abundant water resources. So this creates stress on 2 points. One is irrigation and for drinking purpose. So our aquifers are depleting. Water table is going down. Lakes are dried up in the summer monsoon. There is an excessive peak flow in the monsoon, and off monsoon season there is no water in the rivers. Then there is an agriculture impact on the agriculture and food security. So how does heat impact? So heat leads to premature ripening of crops, leading to smaller grains, resulting in sharp decline in productivity. So this creates, and particularly our staple crops such as rice and maize and wheat. Livestock are affected adversely as well, and that agriculture is supplemented by the livestock. So we have a milk production that drops sharply in the time when we need more protein in the form of not milk but in the buttermilk or chach as we call it. Then the biggest problem with ecological impact is on the forest health. So over the time, if you look at this year, Uttarakhand, Himachal, and entire Himalayan belt, including, if I may include Nepal in that, then we had less fire instances because there were intermittent rains. But other than that, every year now, forest fire incidents of forest fire are increasing. Not only increasing, but the aerial increase and frequency both are shooting up. And the span within which we used to have forest fires have also expanded in a way that in the month of January, in the one of the district close to Badrinath, in Chamoli district, we had a forest fire. Fortunately, that was controlled as per the Forest Survey FSI's reports. So our ecological health will be impacted adversely. And when there is a forest fire, larger areas suffer because of the carbon and the soot and smoke. Then there are economic impacts due to excessive heat, losses due to heat events, food price inflation goes up. So due to excessive heat, your vegetable production, food production affected, supplies are curtailed, quantities are reduced, and it spikes up the food inflation. Then you have a reduced labor productivity because due to excessive heat, labor is not able to produce. You feel lethargic, and that creates a problem. And the worst part is energy demand is shoots up. Yesterday, Delhi had the highest energy demand of this season, uh, and industrial outputs are declined. Now, what can be done to control this at the policy level? So you need heat action plan. You need city-specific heat action plans. Within this, Ahmedabad was first city to create. You need medical MI rooms as a part of this heat action plan. Cities has to be designed accordingly. So heat action plan is just not a medical phenomena, but then you have to look into the city planners also. If you look at the city pedestrian view of the street, whether it is providing trees are providing shade to the pedestrian or not. So most of developed countries are now trying to do that. They are developing landscaping in a way that the pedestrian get shade. If even if buildings doesn't, but then the 6 to 8 feet of high trees with a bigger canopy can shelter the pedestrians. So that is one part. We need local governments with heat restraining building materials. Traditionally, we had building material which was heat resistant, thermally insulating material, but now over the time we have lost that. So we need to have innovative, low cost building material which can be environmentally sustainable as well as the heat resistant. So thermal insulation can be provided at cheaper rates. During severe heat wave, we should reduce the work hours, create shaded rest for the laborers and outdoor workers. And not only just laborers, mind you, your traffic ops, they are standing in the severe heat and coupled with the vehicular emission, coupled with, your emissions as well as heat exhaustion from the exhaust system of the vehicles, apart from environmental and radiation lateral heat from the ground. These people are extremely exposed, and we need to reduce their working hours and provide them shelter and shade. That is a city-specific details I'm going into. Now, special working hours during peak summer months, emergency cooling and hydration sections in urban areas. More, our hospitals should have a modular heat rapid cooling mechanism rooms. In Delhi, if you go to Ramanor RML hospital, they have created a low cost model, modular heat cooling room, and that room furniture can be stored in the other months, and used for other purposes. So, but then heat if you go to Northeast, they might feel heat and they might get heat stroke at 30 degrees Celsius because they are not used to. But a person in Delhi still can survive around 40, 38, 40 degrees. Now, NDMA has developed heat action plans for 23 states. You have urban planning. Now you have national heat action plans. You have outdoor workers and early warning systems. This is critical part, and my colleagues from NDMA must have spoken on the early warning system. What is needed at the moment, and then recently we had a program with the NRSA in Andhra Pradesh, and they said, with the warnings, you give us actionable, inputs. So at what level, what should be done? So we need to develop that, and NDMA gives, accurate hourly prediction of the temperature, felt heat, as well as, rainfall data. Now, to have cities better governed in terms of to reduce the impact of heat, centralized, that's a national level policies such as funding mandates from the mitigation fund. Then NDMA headed by Honorable Prime Minister laid down policies and guidelines for disaster management plan, disaster management at the national level, and these guidelines should be adapted into and integrated into city-specific heat action plans. And then you have to have decentralized local level, state level governments getting into tailor-made disaster plans, particularly heat action plans for the vulnerable and weaker sections of the society who cannot afford expensive cooling equipments. Focus on community-based, building local resilience, building locally available material buildings. These are decentralized. Then government alone cannot work on it. So you have to have a collaborative approach. So you have a multi-sectoral, multi-agency approach where you bring in NGOs, community workers, you bring in private sector, you bring government, central government, state government, and and communities traditional knowledge base also. So then you create a synergy, mobilize resources in a better way, and build the capacity, create awareness among the people so that people are able to stay hydrated, stay safe. There are a few challenges which are operational in nature. I'll skip forward. Political governance could be organizational structure, economic communication. Uh, Now, one of the major part for the heat action plan or to have a policy level is to reach out to people. So what I communicate, I'm at the moment I'm talking in English. People might understand Hindi. Some people might understand Rajasthani. Some might understand Telugu, Tamil. So vernacular languages have to be uh, built into the communication while communicating the heat related issues to the people. And then communication has to also be multi-pronged, not only the social media, print media, but digital micro media. Every channel has to be, we had community radios also. That is also be, factored into. So these are some of the things we have to look into. What is the way forward? So we have to have institutional changes. So it's heat action plans at local level. We have to have research which gives you islands, heat islands, what are the areas within the city at the block level. We have data, micro data, look into which are the districts within that district, what number of the blocks, and within the block, you have number of villages which had the highest recorded temperature last 10 years, 20 years. You look at 30 years, see the trends and focus more on that. This is an nuanced understanding and response to calibrated response to this. We have to create the capacity building of the people. We have to add part of the data collection and research also, and harness the technology using GIS mapping. I think some of these are some of the points from my side. At this point I'll stop. Tamanna, thank you.
Thank you, Dr. Sidh. Thank you very much for sort of laying out the ground on what has happened in terms of heat policy in India. From my previous work, pinning hopes on heat action plans is a bit idealistic in nature because
Yeah.
how implementable it is on ground. This is now time for questions. If anyone has questions, feel free to put in the chat, or I think you can raise your hands on this on the Zoom. But if I could just start with the question, what we saw on ground when we talked to, during our past work, we've talked to people on ground, implementers across departments, health department, urban planning department. And what truly came out of it was the issue of coordinating and bringing together all these departments together.
Right.
Let's not limit this to departments, but also talk about various other stakeholders, since people speakers have worked with the government in their own capacity. How do you think about resolving the issue of coordination when it comes to
so first, let me put in point that I had a meeting with the ministry. So I'm right now here only. You might hear not in my office, so I apology for joining it late. And second, let me answer the ideal part of the answer. So NDMA's heat plans, heat action plans might be ideal, right? So one shoe can't fit all the sizes. But NDMA has also not said that you cannot adapt. And this is where we have to look at the local capacity. When you say that you create a local capacity to be able to adapt to NDMA's ideal plan, that is a broader guideline. If the communities and local municipalities and village people are having that kind of a critical capacity, they can still adapt. And if you look at old methods of hydration and clothing also, people used to, we had a traditional practice of before leaving the house, we used to drink a glass of water. So this creates an hydration in you and you don't get. Now over the time, the communities if you look at desert and semi-arid regions, Piao is a community drinking water availability was always there. Over the time, these institutions are degrading and declining. People are not doing it now. The bottled water has replaced the Piao system. And that is extremely critical for North India. I don't see in Delhi, if I walk across now, even in Lutyens on in ministries and all, I haven't seen a Piao. But there are hundreds of kiosks selling bottle. If you try to drink 2 bottles, 2 liters. So my point is, NDMS plan might be an ideal solution. If we are not able to reach that ideal or exact position, but we can walk that territory, we can walk that path in some way with our own local capacity, locally available material, bringing your past experience. Communities are repository of knowledge, how to deal with heat stress. Europeans don't know how to deal with stress. They'll go crazy, but we are still okay. We'll cover with the. If you go to Haryana in the outer part of Delhi, also people even today they use a white cotton cloth to wrap around neck, so this part of the back of the muscles are protected. One. This unfortunate part that these traditional inbuilt mechanism societies are broken. That is one part. So my only submission is NDMA might have given certain, that is one template. In NDMA cannot go on to the district level. This is a national body. So they can give you a state level action plan, but state to district, district to taluka, taluka to village level has to be done by the local communities and local administration. That is my submission to this gathering. Yeah, you had a second question which I have missed. Could you please come again?
It was around how do you solve for the coordination problem that exists not just for heat, but rather all climate related issues within the government. And this is not just coordinating with other departments, but also stakeholders on ground. How do you truly bring community within heat planning?
Okay, so I think post, if I may, we had, I'll give you 3 examples. So Gujarat, Bhuj earthquake and Odisha super cyclone, that shook our nation's conscience and we had a DM Act, right? One government lost power in Gujarat, one lost power in Odisha, and since then those states are ruled by other parties. So disaster shaped our political narrative also. Let's bring in third disaster, which is extremely critical, is 2013 Uttarakhand, Kedarnath. Prior to this, Met Department's forecasts were mostly taken with a pinch of salt. But now people do take it seriously. If you are going to Kedarnath today or Uttarakhand and you get a message from Met saying that there is a heavy thunderstorm, orange alert, people do think, pause and take a think that, okay, do I really need to go? So thing is, you have to take the Met Department seriously. So local administration has to look into it. At national government level, government is creating a synergy. Various ministries, MHAs coordinating. So from 99, our super cyclone and Bhuj earthquake, Ministry of Agriculture was the nodal ministry, shifted to MHA for better coordination. Government has taken certain steps, but I might say that might be slow at certain paces. But then you have to bring in NGOs and private entities. So there is an industry in a particular area. You can always utilize that industry in the heat action plan. There are private hospitals also. So we can always just not rely on the government hospitals. They are far and few in between at least, but private hospitals are everywhere. So we can make it mandatory. During severe heat, we can, sorry, district admission can enforce the ESMA rule, essential services, and sorry, and always bind these people to come to the community services. But rest is, we can still work on.
Thank you. I think Mr. Pathak had his hands raised here.
Thank you so much. In continuation, what Shiv Narayan ji said, really true. And continuing into same way, just wanted to share the case of Ahmedabad, where heat action plan has been made in now more than a decade ago. Now, it was not that good as in the beginning. Of course, it was stakeholder and engagement was there from the beginning, but later on stage, after they have reviewed couple of times, now the current heat action plan in Ahmedabad is also linked with the finance. And it is also about the, as you said, about the coordination at different sector and group. So now it is also with the early warning system. It is also with the training to health workers on regular basis. It is also about launch public awareness campaign, and not only by municipality, but also by other stakeholders. So these coordinated efforts taking place, but it is not happening from the beginning. You know, it is like a, once we have HAP, and then after it is taking place, and that requires several years. The more important is how we can have that this speed increased to reach out not 40, but it is more 100 and other cities, as extreme heat risk is very high. Thank you.
That is such an important point because from our experience of talking with implementers, what came out was their vision of heat as an issue. Compared to other disasters, heat doesn't take away your buildings, doesn't take away lives at one go. So this is something that, and also just the very nature of heat, so it sort of demands solutions coming across different sectors, and everyone have to come on board. How do you see the government taking, not the national government, because the national government has been taking a lot of efforts and that has been taken up by many local levels, but these are departments or areas which have not seen as much heat as they're going to see in the next few years. And this includes in areas such as hilly areas in the Himachal, in the Himalayas or the northeastern states. How do you envision these people dealing with such a new problem? And what are the sort of low-hanging fruits you see that could be taken up by the communities or the state that are present there? Anyone can take it up.
Well, just sharing one experience, you know, while working with small businesses, we have worked with around 1,500 small businesses across more than 6 cities. And many times, whenever we ask that what you do in extreme heat and do you affect, and some of them replied that, no, we just shut down our business and go home. So it is not affecting. But you know, it takes several conversation to make them realize that whenever we are shutting down, it is loss of income. It is also your daily visitor customer footprint is also decreasing. But they have back there into their mind. But as you said already in your question, we see flood impact, we see cyclone, but not extreme heat. So what Dr. Kishore already said that about the capacity building inputs among this is really very important. And as a DRR practitioner, I see we need to generate more and more case study in both sides in terms of impact of extreme heat, as well as also in terms of anticipatory action cases, how IMD forecast can be utilized, linked with education, linked with health, linked with business. So that needs to be, you know, used as a sensitize among the community. Otherwise, they also know about the adaptation, what needs to be taken as immediately. Thank you.
Yeah, just to add to that, as Tamanna, you rightly said, so what is happening is more like a boiling frog syndrome. So because climate change, or especially the heat wave or the desertification or droughts are not on the face kind of disasters like earthquake or floods or cyclones, so communities are more kind of okay with it, chalta hai type of attitudes, and they are not taking more seriousness. As for example, I'm living in Bihar, Jharkhand. Here, the floods are kind of considered the main disasters, while the heat wave or the desertification, the crop failures are kind of a more of a okay, it happens and part of life kind of things. So that primarily because of this boiling frog syndrome, because these are the slow onset disasters. So that's why it is not much taken seriously. And also how the length of the heat wave has also it is not just the frequency or the intensity of the heat wave, but also the time period. So for example, in my areas, earlier used to have a spring. It kind of a no longer spring is not there. It just till January or till the February we have winters, and then suddenly we kind of jump to the summers. So there's a missing part of the spring, that the 1 month of till the February where we have good season. So that is kind of missing. And how, unless it is not right now, as sir also pointed out, that it is affecting our agriculture, it is affecting our economy, but they are kind of adjusting. So when they are not, they're closing their shops in 12 to, for example, 2 or 3, so they're extending their shops in the evening. So they are kind of thinking, okay, we are closing the shops in the afternoon, but we are extending its time in the evening. So they are kind of looking, okay, it works out, so not much challenges. While talking about bringing the person with disabilities point of view, that how they are kind of not even in the talking sense, or not even mainstream. So for them, it is just like most of the person with disabilities are either even working from home, or they don't have their job or employment, so they are living in the home. So it less of a income oriented thing for them or challenge for them. It is more of a how they are not accessing medical care because of them, because in the lot of person with disability, their flares up, their symptoms becomes more frequent and intensified, and so they need to go more to the doctor, and thus their medical cost increases. But it kind of internalize in our mindset that it is okay, it is natural process, while not integrating that how it is kind of a humanity induced climate change related consequence of that, the heat wave is intensifying and so on. Thank you.
Thank you, Abhishek. Yeah.
May I just add something small, like in concurrence with both the previous speakers. So in heat wave, like we all agreed, we can't see the damages like flood, but losses are so much, and we don't have any study, India specific study, which can calculate those losses. Like even if an MG worker is not able to work for a day, timings are changed, but then we don't know, like normally every all of us are used to work say 9 to 5, but suddenly somebody says no, abhi heat wave hai, you will work morning 6 to 11 and evening 4 to, you may not be as efficient as you were. All these things, I mean, if there are academicians in the room, we need to start having those studies, and loss should be quantified. Heat is purely loss based, and those losses are terribly high. We can't even imagine. It's a we or most of us know, we always call it a silent killer. So that is a study that we require to take up. I mean, there is AIDMI, there are other organizations here who can lead these kind of things. Thank you.
Yeah, but that's absolutely true, Mr. Khare. There is a study by ILO that states that India might lose 5.6% of its working hours, and those two in just outdoor heat exposed occupations, which is a crazy figure and sort of tells you the amount of things you have to do to
5 hours per day or per week?
5.6% of working hours
Per
in
percent. Okay, okay.
by 2030. So that is a projection of figures we're looking at. Um, uh, I I'm not sure how much time we have. I was supposed to ask for key takeaways from all speakers. Um, while most of us have done that already, can I ask Dr. Kishore to sort of speak about? You've already spoken about the sort of actions needed for the health system. But just going from what we found on ground, all the actions, long-term sort of systemic actions, are still housed within the health system. So, for example, training of the health staff or sort of heat death surveillance systems. I agree that while these are important, it doesn't mean that it is preventing heat deaths from happening in the future. So, what do you think are some of the things that are required outside the health system and within the health system to sort of build that future resilience to heat?
Yeah, very well required. Awareness of each sign and symptoms arise because of the heat exposure, and various issues which we have discussed about comorbid conditions. And I think every health condition get affected due to heat. like the cold and heat, they are something which are affecting our every cell. So if everybody knows, then I think they can think of and what are the remedial measures in short term and long term. So this resilient, which has been now a buzzword for everybody, that we can resilient. And I think Abhishek has rightly said, and I have also pointed out that we have a frog syndrome, where slowly we can see that yes, in Gujarat and Rajasthan, people are still staying at 50-degree temperature. What is wrong? They can survive and they are surviving. We used to have the desert and should not be a problem, but every reason and everything has a impact on it. We all are aware of the studies and deaths in Russia, where just a few degree temperature change can kill people, and same temperature may not kill in India. But it has a limit, and that limit is actually crossing, and we have already crossed, and it is continuously doing it. So overall understanding of these impacts to common man is important, and the doctors and the health staff has to come forward for this. We require more studies, definitely. That is why the research involving the human being, including the medical sector, is very important. And we have the organizations like ICMR has to focus on it. Still, I can find that they are now giving some funding to air pollution, but to other, still they are not doing it, and we require more funding on those areas. Uh, and then structural changes, like all hospital, when patient goes there, at least uh, we can restore health, and it should not be that we don't have the working AC or cooler. Or I today visited one of the MCH center in Srinivaspuri, and I was shocked that the temperature was high, and we have a tin shed, and shed was there. That much can be done, but I said, cooler should have been there, because heat wave has already directed the, health sector to gear up for such kind of actions, and it takes time. I don't know, what is the problem. So some implementation management issues are there. So this mainstreaming which you have given to me, I am agree with this, that all places in health system require that action to be part of it, and we should see that this is working. Then we can save life. At least when patient is reaching to hospital, they can survive, and it is not that we can't. Sufficient amount of the fluid and hydration is important, so at least they can maintain this. So people knows, the doctors knows, and then our all health staff is knowing that this much can be done, so we can save people from this. So that is what resilience is. But ultimately, we have to change the whole ecosystem for prevention of these things to save the life.
Thank you, Dr. Kishore. Just to summarize, I think I'll use what Dr. Kishore said about how heat deaths are preventable. But for that, we need solutions across scale, across sectors. We need to think about how do you bring in community, how do you preserve the traditional practices that have been going around in an already hot country like India, and how do you bring that within an inclusive and equitable policy framework, where the heat action plans are the way to go. How do you localize heat action plans within the government to sort of cater to the localized needs? Thank you everyone for joining us today. I now hand it over to Gursimran for a vote of thanks.
Mike.
I think my earphone is not working. So Thank you so
It's
much,
welcome.
all of the joining today's session, and it's very insightful sessions. And and very big thank to our speakers for sharing their insights, and our moderator also leading the discussion so well. And we would like to thanks our partners also, like NIDM. Dr. Shiv Narayan sir and Atisha ma'am and Vardhman Mahavir Medical College Sub-Division Hospital, Dr. Jugal Kishore also, and for their supporting in organization this webinar series. And I also thanks participants for your time and interest. And we will have more webinars on this topic and many other related topic also. If you have any feedback, suggestion, or questions, just feel free to write to us and stay our social media channel for regular updates from Spare India Academy. And stay safe. Take care. Thank you.
Many thanks. Thank you,
everyone.
Tamanna.
Thank you.
Thank
I'll
you.
take your leave.
Thank
Okay,
you.
bye-bye.
Thank you, everyone.
Thank you, Vishal sir. Thank you, Omkar sir. Thank you, Abhishek sir. Thank you, sir.